Can you be seen?
No,
You should be seen. Is everybody in front?
So I guess we have to start the show now. Thank you.
Yeah. This is the pre. For those of you watching, you get the pre-effects. Pre-show.
Alright. Don't have a sound check, so could you sound check us, please? FB Live.
For those of you watching, if you can hear us, press 1 or like this video.
Or scream.
Scream? You can't hear them.
You don't know my powers.
Oh, okay. He has magic powers, apparently.
No, thank you for tuning in to the Opportunities to Serve, that's Opt to Serve radio show. I am your host, Tyrone Robinson, and I have a pretty full cast today with me, starting on my right with Miss Caroline Grimm. Miss Caroline, where are you from? Who are you? What do you do?
Hi. Well, first of all, it's a pleasure to be here. My name is Caroline Grimm, and I am with Good Health Pharmacy in Chester, Pennsylvania. I am married, have 3 children, and I live in North Wilmington.
Nice to meet you. Nice to have you here.
Thank you. It's a pleasure.
Also, Caroline serves on a board with me, Providence House Clubhouse of Chester.
Yes.
How are you enjoying your boardship?
So far it's been an amazing experience. It's always just a pleasure to be out there to serve the community. We actually had the Thanksgiving dinner yesterday, and I brought my 3 children with me, so they also had a great opportunity to work in the community and serve as well. And I look forward to the health fair that we're planning at Winder University in the spring. So we have good things working, together at the Providence House.
Very good. Thanks for coming in.
Thank you.
And to your right.
Hello all. Great to be here in the mood of Thanksgiving. I want to extend my thanks to everybody here. I'm Kelly Keefe. I'm currently living up in Brooklyn, and I'm a public speaker and an energy coach that goes anywhere from spirituality to mindset. And I'm looking forward to being part of this interview, and as things grow, you'll be hearing a lot more from Ty and myself interviewing people come 2017, so stay tuned for that.
Nice way to slip that in there. Ms. Mendez, are you in the building today, or are you just camera crew?
I am here, but I'm also in camera crew. Hello, everyone, and happy early Thanksgiving.
Alright, so with that, if you're not familiar with what we do here and why we do it, the expectations are as follows. This show will always be a source of information to its listeners about health and wellness, employment, and business. We're going to seek to always have a guest that could possibly inspire you to pursue your passions. If that is to start your own business, be in business, serve the community in some way. We'll also always have people here that are willing to network with you, help you, provide additional resources and supports toward your paths or goals or dreams or whatever the case may be. And so that'll be my responsibility to you guys. I guess all I ask is for you guys to participate, not only with myself through the Facebook Live feed or my personal Facebook or my business Facebook, Opportunities to Serve, or LinkedIn or Twitter or Instagram, whichever way, including email, you choose to participate. Just ask your questions for our guest, and I'll send them out to them. I'll always have their information on my website so that you can be able to find them either through LinkedIn or their social media or their email. Whatever the case is, I want to encourage the community involvement and just continue to grow what we're doing here. It's not for me, it's for us, and I'm hoping that we can grow together through this network that we're building here on TuneIn, but also on Facebook Live. So again, if it's not for you, tell someone who it may be for. That could be a high school grad, a college grad, a person that's going to work every day but considering doing some other things. Whatever the case is, we want to be able to help you and just provide the type of knowledge that you may need to get to your next steps in life and in business. Sound good?
Sounds good.
All right, cool. So Caroline, do you want to take a break? You ready to go for this interview? How you feel?
I feel great. Let's say we continue.
All right, all right. So, as I said, our guest today, amongst our special guests, Kelly, Iris, is Miss Caroline Grimm. As I mentioned, we serve on a board together. She is the newest board member of the Providence House of Chester board. You've been doing a good job. We appreciate your insight and your willingness to help us out toward our mission of being the best clubhouse, not just one of the best, but the best. And some previous knowledge about Caroline and how we met her. She actually attended our first annual health fair. I don't know if we gave it a tag name, I forget. But she was a vendor there, and while there, she brought one of her daughters, correct?
Yes, I have Carly with me.
And, you know, we got to meet her. She got to meet us. I think we spoke for an extended amount of time
We
in
did.
between me running around trying to help things go smoothly. And Caroline communicated an interest, I think, that day, correct?
Yes.
In helping us out and doing what we were doing to not only further the community with good health practices and wellness, but also helping the community acknowledge mental health, mental illness, and what Providence House, if you don't know, is a clubhouse based on the opposite of the rehabilitation model for people suffering from mental illness. What they do is encourage not only the community integration aspect of wellness and mental wellness, but they also encourage the members to run the clubhouse, and the staff is just there as support, some hand-to-hand know-how and things like that. And so it really encourages people to be great on their own, and in mental health and probably in all aspects of life. It's very important for us to be able to do things for ourselves, see the results, be motivated by them, and help others along their path. And so after this Wellness Day, I'm going to call it Wellness Day,
Okay.
how'd you feel about participating, and how'd you feel about those you met that day?
It was a great honor just to be there. Like, Tyrone was saying, I was there as a vendor. We were fairly new in Chester as a retail pharmacy, so to go to any type of fair, especially the one that they put on at Weiner, was a really good opportunity. And I have a sister who is bipolar. I have a brother who is bipolar. And I know medication, and not even just medication, but just they need a lot of support. So having that in mind and just having that personal experience with family alone, it's very important to me. And the clubhouse, becoming a board member or just being a part of it that day and just seeing the members were incredible people, and I was just so amazed in how active they were. Everyone had a job to do, everyone had a role, and they were happy. And it was I just felt the sense everyone was a very close-knit family. And after meeting you, Tyrone, and Courtney Smith, I just thought, this is where I need to be. And I want to be a part of it, and I want to do more with the program and make it the best in the country.
Very good, and here you are.
Yes.
And like I said, we definitely thank you for your interests and actually joining and following ahead with what you had on your mind for the reasons you had them there. I guess the next most recent transition for you was your grand opening event.
Yes. So we're right in Chester. We're on 9th and Ingle. And in the beginning, the partners wanted to have an opening right away, but like anything, you really have to build the relationships within the community. So we didn't have the opening for like post 6 months, and we had a phenomenal turnout. We had the deputy mayor was there, a lot of business owners, a lot of our own patients came out to support us. It was a rainy day, chilly, and we had a full house. So the support that the community and just our own patients came out was just, it was very humbling, very, very humbling, and it just made us realize that we have to really keep going forward and getting the word out of what we do and why we do it.
So who were some key people that came out?
We had Deputy Portia Rose, she was there. We also had the Director of Education, I'm drawing a blank on her name right now, but she was there also. And just the local doctors, the primary care physicians, Crozier Hospital came out. Some of the home health care facilities were there. So with the people that we need there just to collaborate within the community to reach our goals in high levels of patient care.
So to those people who came out for good health, could you please request that they come out for us at Providence House at Widener University?
Absolutely, yes, please. For all those who were there, definitely we'll keep you posted on the upcoming event. Come and support us. It's a wonderful program within Chester. The things that they do, the art classes, the meals that they receive, the guidance, the education, the job placement. I just can't say enough about the Providence House.
Very cool, very cool. So to your business, Good Health Pharmacy, I'll ask you, what do you specialize in? How long have you been in business? And what is your business philosophy that keeps your business not only open, but provides a competitive advantage for those who choose you and not others?
So with Good Health Pharmacy, we opened our doors March of this year. And how the whole idea came to fruition was about 5 years ago, a dear friend of mine who was a home health care nurse locally in Chester, I was managing a pharmacy in Delaware, and he said there's such a need in where he works for people just to get their medication, because in the demographic area, the elderly, a lot of them don't drive, especially those who are in like adult behavioral health. Those patients. So we were actually servicing a handful of those of people in Chester, and we started growing. But the distance, that was like our biggest obstacle, was just the distance between the two cities. So we just decided to go ahead and open in Chester, and our vision was to bring pharmacy to the people. There's a lot of elderly people who they either can't drive, and the biggest reason, not only just driving, but also when you get to a certain age, it's the compliance. A lot of times, number one reason they're not compliant is just simple, they just forget. They just forget to take their medication. And then also those who are on any psych meds, a lot of times, the number one reason why they're readmitted back into the hospital is due to non-compliance. So we just thought, what can we do to help break that cycle, or at least reduce the numbers? So we started to blister pack, and a lot of pharmacies, independent pharmacies, do blister pack medication. But what sets us apart from the others is once we get a referral, we actually go to the home and we see what their living habits are like. When you get up, where do you have your coffee, or where do you take your medication? Or in the evening, the same thing. We just see what their daily routine is. And by that time, we're building a relationship and trust. And that's the most important part, because we're not just looking just to prescribe the medication. We want that long-lasting relationship, and our goal is their overall health. And depending on the person, we might blister pack for a week, bi-weekly, or monthly. Some people, we can do 4 cards in a month, and they're very compliant with that. They're fine. They just need the dates. They just need to see what day the medication is in. But we have other clients where we have to see them on a weekly basis. And seeing them routinely, it's just, you have that caring level. You know, we're more hands-on with them, especially with the elderly. If we see a decline in them, a lot can happen with the senior within a week or a month. And if we see a change in them, we're able to call their primary doctor right away, a family member. So that's the niche that we have. It's just a very caring element, and just being an advocate for them, even if it's something else that they need or help with choosing the right Medicare plan. Like right now, it's open enrollment for Medicare, and it can be a very arduous time for them. You know, we're able to refer them to people that can help them. If it's home health care that they're looking for, you know, we're able to put them in the direction for their needs to be met. We had one patient that didn't realize that they qualified for PACE. It's a different program from Medicare that'll help additionally with their prescriptions, and that's saving them money a month. So we're just an advocate for them all the way around. But the most important thing, not only taking care of them, is collaborating with the doctors, their loved ones, their friends. Whatever it takes, we do our best to meet their needs. And a lot of, we have great success stories where this program is literally keeping a person living independently. And at the end of the day, that's what anyone wants, is their dignity and their independence.
Absolutely. This is such a great vision and niche that you're fulfilling. How are you going about finding your patients that you're working with?
So when we first open, of course, you always go to the primary care doctors that are just, your local doctors in the area, explain the program, who we are, where we are. The hospitals, also home health care. We've been very successful, especially in home health care, because what will happen is when a patient gets discharged from the hospital, they might have a series of visits, and with home health care, and they're wonderful, they meet all of their needs, and they'll also put their medication in pill boxes, but once the service is done, they're on their own again. So now we're trying to really bridge that gap and meeting the patient in the beginning with the home health care nurse, and for them allowing us to manage the medication part for them, and that's been very, very successful.
Sounds pretty admirable. In your immediate area, and also including Delaware, how many people or how many other organizations were sort of pinpointing on this problem or issue? And I ask that because I want to know who your competitors are or were, if you haven't already passed them or surpassed them in some way. So who were your initial competitors, and how did you grow to overcome the competition and or offer your client some way to identify you as the best and not the other person, even though they may offer similar services or even similar amounts of care?
And that's a great question. One thing for sure is knowing your product and knowing and being passionate about it. And when you're passionate about anything you do, no matter what it is, people feel that and they see that. And knowing your customers, knowing them by name, knowing their story, knowing what their elements are, and being there for them, making follow-up calls for them, and knowing your competition, knowing what they offer, and knowing what they don't offer, and actually at some point even working with them.
Absolutely.
And because at the end of the day, there's always business for everyone, but what makes people come to us or refer someone else to us is that we really go beyond a call of duty. I mean, we're just there for them in any way, and just being in the home and offering a weekly delivery service, which is also free. And there's other businesses who do have free home delivery service, but actually managing the medication on the level that we do has really set us apart from anyone that's local in the area.
Okay. Iris, with your in-home experience and in your current profession, what do you think about Good Health Pharmacy and the way they handle business and approach their customer base?
Well, for those of you who don't know, I am a wellness coach and I have a background in social work and mental health. So given the information that I've gotten from Good Health Pharmacy, I think that what's important or what sets you apart, based on what I've heard thus far, is the continuity of care and the ability to meet your clients where they are, literally. I actually went to Widener, so I'm familiar with the area, and they lack in grocery stores, let alone pharmacies. And nowadays, most grocery stores have pharmacies in them. So just to have that in the area for this specific population, I think is key, and I don't think that I've necessarily heard anything like it where you're literally going to the homes and meeting the clients in their homes and ensuring that, empowering them really
Yes.
to take over their own lives and with their own compliance and medication, because it can truly be debilitating, because I've seen it firsthand in my experience. My question to you, without violating any like HIPAA or anything,
Sure.
is there a story that you can share, or an experience, a client story in a sense of successful story from someone who has, been a part of Good Health Pharmacy?
Yes, we do have a gentleman who is, he's on a lot of psych meds, and we received a call from his case manager and said, we have the most challenging patient for you. And he's about, our concern is that he cannot live independently anymore, and the only reason is that he's just so non-compliant with taking his medication. So of course there's, we're up for any challenge, and so we went ahead and I met with the case manager within the home, and I have to say, he was right, it was very challenging. And the first thing, like I said, just building that relationship at first. He was a little agitated. He's an only child. He's in, I would say, his 60s. Does not have any family. I believe his mother might have just passed, but really doesn't have like a lot of support around him. And we just started 1 week at a time, and we filled 1 week's of medication, then we go back and we instruct them how to use it. I mean, from A to Z. I checked with him in 2 days, and the blister card was just a mess. Pills were all over the floor. So I went ahead and retrieved and cleaned everything up and just brought it back to the pharmacy, and we just started over again. I would say by week 3, he was doing amazing. He's been with us now for about, I want to say 6 months. And he loves us. He might miss a day, like a dose here and there, which is phenomenal, you know, for him, but I would say he is 99% on track. And we see him on a weekly basis. I mean, we're his cheerleader, and we encourage him and just say what an amazing job he's doing. And he's living independently.
And
So,
this was somebody who initially they said he wasn't
Yes.
going to be able to live in. That's awesome.
yes. And then if there's a change or we see something different, you know, we call the case manager, but it's working with the case manager, even the manager of his building. It's just pulling anyone in that is willing to help for the individual. And if you can touch one person's life, it's worth it.
Absolutely.
It's truly worth it.
It's amazing. I'm sure there's so many other success
We
stories
do.
too.
We do, and it's very rewarding. And I just think, where would they be if no one was out here doing this? So we're very passionate in our work. We have an incredible team. Our pharmacists, their clinical experience, their patience, their expertise. They give so much. But it's rewarding, really, what we get back from those we serve. It's not a bad day to go to work.
I hear that. Back to our in-studio guest, Miss Caroline Grimm. Again, we're glad to have you out.
It's a pleasure to be here. Thank you.
A few of my guests, including myself, have more questions for you, more specifically to your why, more specifically to your passion, and your passion being about things that you care about or want to educate the community on. And who wants to shoot first?
I'll be the crazy go-getter. So one of the things that I really noticed that we were talking about a lot is the importance of a community being built. Down to during the time of building and pre-launch, we were really connecting with the community, within the community, to build that trust. And also that's taking a village for all the patients that you're working with. How did you go about getting really connected with the community prior to opening, and how have you seen that play an impact on the success that you're having?
Absolutely, yes. So the first thing, of course, once the doors are open and it's day one of business, it's such a big relief, but now it's okay. We need people. We need the revenue coming in. But so what we do is we just put a marketing package together, and we'll give education on what we do, our business model, and we go to the local, just the local physicians that are in the area. And then from there, we go into the hospital, and we meet with the different nurse practitioners, also doctors within the hospital also. And then the third step was reaching out to home health care and just building that relationship. And, being in Winchester, it's a very close-knit community, and I found it very important to really connect with the local people, even on a government level. So I started to attending the Healthy Chester Coalition, which they did meet once a month, but now they're meeting every other month. And Rosetta Carter, that was the name I was trying to think of back at the Urban Cutting. So Rosetta Carter is the Director of Education there, and she has really embraced our new business for what we do, and helping those within the community, and just staying connected with the Chester Healthy Coalition, sharing ideas. And another thing, not only just with what we offer, but learning about what the community offers. So we're able to share that back with our customers, and it's been successful.
I have a follow-up question. You're talking about like the local hospitals. I have an experience of working in hospitals, so my question to you is, what are the thoughts of local hospitals in regards to medication compliance and medication management, based on your experience?
This is actually a very big issue with them. A lot of times, the number one reason why a patient is readmitted back within 30 days to a hospital is noncompliance of medication. And in 2012, Medicare has started penalizing hospitals if you return back for the same condition. And that's a very big concern for them. So the last thing that they want to do is see the patient. Of course, they're there to care for them, hands down, but so their goal is not for that patient to come back. So they'll refer them to home health care, which is a great next step. But as I was sharing in the first segment, once the home health care nurse is gone, the patient is back on their own again. And that's why if anyone is out there listening in the hospital or home health care, this is the bridge to really reduce those numbers. And it's only by us working together and keeping everyone informed of what's going on with the patient. And we can only do it by providing this service one patient at a time.
So what can help you in your business as far as meeting that goal of meeting one patient one at a time? What can you do, or what can we do, or what can people in the community do to create awareness, and then also to be able to, I guess, provide a testimonial somewhere? You don't have the website up, and
No.
so I assume testimonials, like in any business, would be a pretty good advantage to have. What are some
Absolutely.
ways that you can share with us that can help people spread the word about what you're doing and how you're doing it?
I definitely believe by just continuing to be engaged in the community, whether it's meeting with you, the Providence House, being a part of that, still attending the Healthy Coalition meetings, and still just staying in front of the doctors and the nurses and the hospitals, and just trying them to, keeping them engaged and not losing focus on what the real goal is.
Okay. Have you anything else that you want to share with us that we didn't ask, didn't cover? Is there a question that you wished we had asked you? Is it something that is on your mind that you want to share with people in order to help them create a good decision by choosing you? So yeah, the floor is yours for a couple minutes.
Oh,
What's
sure.
on your mind?
There's one other program that I just would like to share, and this is for the blind or the visually impaired, and it's a program called Script Talk. And Script Talk is a device which the patient receives free of charge from Script Talk. And it's a plastic device, very simple to use, and only has 3 little buttons on it. And what it does is when we fill the medication, there's a little tracker that's on the bottom of the vial, and it actually sits on top of the Script Talk base, and it reads what the medication is. It gives the name of the patient. It gives the instructions on when to take it, how many times to take it. And what this does, again, it gives the patient independence. There are other local pharmacies who do have Script Talk. The added benefit that we do is we go to home. We see how they're living, where's the best place to place this device for them, and just giving them the extra hands-on until they get familiar with the product.
Okay, sounds good. You guys have anything else to add?
No, just thank you for being here.
Oh, it's a pleasure. Thank you for having me.
When we went on break, I did mention that I think this is an innovative approach, and I think you or a good health pharmacy is the future.
Thank
for
you.
How we help patients and just people in general manage their overall health care as it relates to mental and medical health. So you're doing a good deed here for a lot of people.
Well, thank you, and I have this Emily as good as my team, and so I'm very grateful for the people that I work with, and and the people that we serve. It's a great journey.
Very excited to see how this grows and with the new location opening up in the very near future.
Yes.
To see how quickly we can help everybody have that independence that you are starting to help everyone achieve. So.
Thank you.
That's pretty good. And with that, I want to thank Iris for coming by as usual, KK, Kelly Keefe for chiming in. This is her second time on the show in some way. And Miss Caroline Grimm, we are happy to have had you, learned about what you're doing and how you're doing it and how it can benefit you. If you want to share one more time how people can reach you, do so now.
Yeah, so for the time being, you can definitely reach me by email, ghrxcp@gmail.com, or you can call the pharmacy 610-497-1015.
Give me a chance to show you my day.